Intrauterine devices. What is intrauterine devices? It is a form of birth control which is small, flexible, plastic and T-shaped device that is inserted into the uterus. There are two types of intrauterine devices, the copper IUD and the Mirena IUD. The copper IUD, it is a non-hormonal IUD, but it has copper which kills sperm and egg, which prevents fertilization. It's effective as soon as it's been fitted and it lasts for 10 years. The Mirena IUD, it is a hormonal IUD that contains progesterone called levonorgestrel. It prevents pregnancy by thickening the mucus inside the cervix, which prevents the sperm entering into the uterus. It takes 7 days effective and lasts up to 5 years, or it can be possibly 7 years. An IUD may use to a woman who never had children called nulliparous woman, a woman who had children called multiparous woman, and also to a breastfeeding mom. What to expect during intrauterine device insertion? Placing an IUD may make you nervous, but a little understanding of the procedure should help you feel more ease. If you're taking a birth control as prescribed or have a negative pregnancy test, the device can be inserted at any time you would like. During the procedure, you will lay down with both feet on the stirrups. Your provider and the nurse will be in the room along with any other support person you'd like to bring along. First, a speculum is placed. Then, several cotton swabs are used to obtain cultures, and an aseptic solution will be applied. Then, your uterus is measured using sound. Lastly, the IUD is inserted. The device is inserted in a collapsed position, then enlarged to its final shape in the uterus. The woman may feel sharp cramp as the device is passed through the internal cervical opening, but she will not feel the IUD after it is in place. Common side effects of an IUD are pain, bleeding, and dizziness. They may have irregular bleeding and mild cramping for 3 to 6 months. As your body adjusts, periods may become lighter and shorter or even stop completely. It is contraindicated to a woman whose uterus is distorted in shape because the device might puncture the uterine wall. It is not advised for a woman with severe dysmenorrhea or painful menstruation and has a history of ectopic pregnancy because it might increase the incidence of this condition. The copper and Mirena IUD have strings that hangs on the cervix to the vagina, which helps the doctor to remove it. You can also check your strings with your fingers. Most men will not be able to feel the IUD during sex. However, if they do, it's not painful and the strings will soften over time. Using tampons while IUD is in place is safe, but do not use tampons for 48 hours after IUD is placed. After that, do not pull on IUD strings when removing tampons. You can check your IUD strings once a month if you want. Then call your provider if the strings are not present. Wait at least 48 hours before having sex after IUD is placed. Then contact your provider if you develop discharge, odor, or pain during sex. If your IUD becomes dislodged from your uterus, there is a chance that you will get pregnant, and also there is a tendency that may cause miscarriage or ectopic pregnancy. This is where the embryo tries to go out from the uterus. So, you should alert your doctor urgently to prevent the possibility of infection or miscarriage during pregnancy.
Advantage: it protects against pregnancy for 5 or 10 years, depending on the type. Once an IUD is fitted, it works straight away. Most people with a womb can use it. There are no hormonal side effects, such as acne, headaches, or breast tenderness. It does not interrupt sex. It's safe to use an IUD if you're breastfeeding. It's possible to get pregnant as soon as the IUD is removed. It's not affected by other medicines. There's no evidence that an IUD will affect your weight or increase the risk of cervical cancer, uterus cancer, or ovarian cancer. Disadvantage: your periods may become heavier, longer, or more painful, though this may improve after a few months. it does not protect against STIs. If you get an infection when you have an IUD fitted, it could lead to a pelvic infection if not treated. Most people who stop using an IUD do so because of vaginal bleeding and pain, although these side effects are uncommon. Intrauterine device or IUD are birth control option that can be used by teenagers. Teenagers have been using IUDs for years and safety and effectiveness are established. But intrauterine device or IUDs are not often prescribed for very young adolescents because such teenager may not yet have a uterus large enough for a safe insertion. One last concern that research has revealed about IUD birth control used in teenagers is pain. Studies have shown that painful or difficult IUD insertion, intrauterine devices, and the premenopausal women. Women who are premenopausal are overall good candidates for IUDs or intrauterine devices because IUD or intrauterine device in perimenopause, it has many benefits. It treats or manages perimenopause into menopause. First benefit is reduce bleeding. IUDs or intrauterine device help to decrease menstrual flow and or stop your periods, so that heavy bleeding towards the end of your reproductive life cycle can definitely be ceased by using an IUD. Number 2, reduces symptoms. If you have an IUD placed in uterus and that stop or cease the bleeding, it cures that the number 1 issue and help to reduce those hot flashes, night sweat, or other issue with that estrogen. Number 3, reduces uterine cancer. Intrauterine devices and the postpartum woman. Although postpartum insertion of an IUD is usually done after a 6 weeks postpartum checkup, it can be done immediately after childbirth. Yet another time for insertion is after unprotected sex as postcoital protection. The insertion of intrauterine device or IUD after childbirth is simply and easy to undertake if the correct procedure is followed carefully. This procedure can be done immediately after the placenta has been delivered and is described as post-placenta IUD insertion or simply as PP IUD insertion. The advantage of IUD insertion at this time is that it is an occasion when the healthcare professional is already attending the woman, and since the IUD insertion takes only a minute or 2, it is a convenient opportunity and save time for both of them while also avoiding the need to arrange a second visit to a clinic.
Surgical methods of reproductive life planning, often called sterilization. A vasectomy is one form of sterilization. A vasectomy is a surgical removal of vas deferens. Ang vasectomy may elective surgical procedure sa male sterilization. Ito ay permanent contraception ng mga lalaki. May ginagawang procedures na nasa basa diferensya. Ito ay gina-prevent niyang sperm para di makapasok sa urethra, thereby preventing fertilization of a female through sexual intercourse. Sa vasectomy na ginagawa, may small puncture that no scalpel technique na ginagawa sa scrotum. And the vas deferens and flash ay ginablock niya naman ang passageway ng spermatozoa. Sa vasectomy, ang lalaki ay makakaranas ng small amount of pain. Pero kaya naman siya i-manage sa pag-inom ng mild analgesic at pag-apply ng ice to the site. It can remain viable for as long as 6 months. So, therefore, pwede pa rin mag-sex intercourse ang lalaki within 1 week. In additional birth control method. Before the procedure begins, you will be given an injection of local anesthesia to numb the area. In conventional vasectomy, a scalpel will be used to make a small incision on one side of your scrotum. The thin skin pouches that cover the testicles. Your physician will locate the vas deferens and let it through the incision. At this point, you may feel a falling sensation. the vas deferens will be cut in a small piece may be removed. Next, the newly ends of vas deferens will be tied, sealed with surgical clips or cauterized. The vas deferens will be returned to the scrotum and the incision closed with stitches. The same steps will be repeated on the other side of the scrotum. In the non-scalpel method, your doctor will use a special ring instrument to hold and expose the vas deferens. From this point on, the procedure is the same as conventional vasectomy. This method is associated with faster healing and fewer complications, and it's just as effective as conventional method.
Tubal ligation. During tubal ligation, the fallopian tubes are cut, tied, or blocked to permanently prevent pregnancy. Tubal ligation prevents an egg from traveling from the ovaries through the fallopian tubes and blocks sperm from traveling up the fallopian tubes to the egg. The procedure does not affect your menstrual cycle. Ang tubal ligation, kung saan ang mga fallopian tube ay tinatali, pinuputol, o hinaharangan upang permanenteng maiwasan ang pagbubuntis. Sa pamamaraan na ito ay hindi nakakaapekto sa iyong menstrual cycle. How is tubal ligation is done? Tubal ligation is done in the hospital while the patient is asleep and pain-free using general anesthesia. A small incision is made to the abdomen and a small telescope laparoscope is inserted. The fallopian tubes are tied off and cut apart. The skin incision is stitched closed. The patient is able to return home within a few hours after the procedure. The advantage and disadvantage of tubal ligation. Ang kabutihan ng tubal ligation ay permanenteng pinipigilan ang pagbubuntis kaya hindi mo na kailangan ang anumang uri ng birth control. Ang pinsala naman ng tubal ligation ay hindi nito pinoprotektahan laban sa infection na nakukuha sa pakikipagtali. Design and symptoms of tubal ligation. Ilang mga kababaihan ay maaaring makakaranas ng pagkahilo, pagkapagod, bloating, o pananakit ng mga balikat. How long is recovery after tubal ligation? How long it takes you to fully recover depends on the kind of surgery you had. After a laparoscopy, it usually takes about 1 week. After a mini laparotomy, it usually takes 1 to 3 weeks. If you had a mini laparotomy after having a baby, your recovery may take longer. How effective tubal ligation for pregnancy? Tubal ligation is really great at preventing pregnancy. More than 99% effective. This means that fewer than 1 out of 100 people who have tubal ligation.
Surgical methods and effect on sexual enjoyment. Both tubal ligations and vasectomy may lead to increased sexual enjoyment because they largely eliminate the possibility of pregnancy. However, if either partner changes his or her mind about having children, the surgery may become an issue between them that interferes not only with sexual enjoyment but also with their entire relationship. So, based in my research, surgery improves sexual desire, frequency of sexual activity, and satisfaction in 85%, 88%, and 94% respectively. However, 31% of the females did not regain desire and 46% still felt discomfort during sexual activity. The rates were 7% and 17% in males respectively. We all know that tubal ligation permanently prevents pregnancy, so you no longer need any type of birth control. However, it does not protect against sexual and transmitted infections. But if everyone changes their mind and wants to have a child, it will be a problem because the ligation is permanent. Surgical methods and the adolescents. As a rule, counsel adolescents to use more temporary forms of birth control because their future goals may change so drastically that what they think they want at age 16 or 18 years may not be what they desire at age 30 years. We know that many young people have children early at the age of 18 or maybe 18 or less. The temporary methods to prevent early pregnancy is using female condoms, diaphragm, cervical cap, spermicide, contraceptive pills, patches, vaginal ring, and implants. And the other is natural family planning. But if they still fail, a vasectomy or tubal ligation is the method of reproductive life planning for them, the option will still be available. But I just want to add, if the men undergo vasectomy, the testes still make sperm, but the sperm die and absorbed by the body, and the man who has had a vasectomy still makes semen and is able to ejaculate. Surgical methods and the perimenopausal woman. When a woman realizes childbearing for her is complete, a vasectomy for her partner or tubal ligation for her are the two most frequently requested forms of contraception, as they require no further expense or motivation for success. As a couple, they have a choice whether they want to have children or not. They can undergo a vasectomy for men and tubal ligation for women because this is one of the choices if they want to do family planning and to reduce expenses. Surgical methods and the postpartum women. Tubal ligation can be done as soon as 4 to 6 hours after the birth of a baby or after an elective termination of a pregnancy, although it may be more common at 12 to 24 hours after birth. The abdominal distension at this time may make locating the tubes difficult, so a mini laparotomy may be used. Such procedure can be done in an ambulatory surgery department with a woman under local anesthesia. So the laparotomy is a surgical incision in the abdominal cavity. It is done to permanently prevent a woman from becoming pregnant. So look at this picture. This is the laparotomy. Mini laparotomy is a form of tubal ligation and it is a major surgery. This procedure requires one cut in the pubic area.